watching Good Morning San Diego.
Transferring fat cells from one part of the body to another, can it be done? Well, our next guest, Dr. Jeffry Schafer, says it's the latest trend, and the new procedure is even considered green. So the doctor joins us this morning along with Tracy, a patient. Good morning to both of you.
Good morning.
This sounds too good to be true, taking fat from another part of your body and putting it where you want it. Is this really going on?
It sounds like a fantasy, but actually people are very excited about it. We can take your unwanted fat from one region, say your thighs, and then we can move that to a new home. It can be your face, it can be your breasts, it can be your buttocks, your hands. And we've also done a lot of corrective surgery of people with accidents or people with scars. Or we have one fellow we're doing on Tuesday with a caved-in chest. So there's a lot of applications for it.
So tell us about Tracy. She's a patient of yours. What did you do to her?
Well, Tracy has that beautiful English bone structure and
accent.
And the accent to go with it. And she was looking, I think, older than her stated age. And she's very thin, and so she had lost some of her fat in her face.
Okay, this is the before picture.
Right. So we were able to take fat from another part of her body and prepare it with stem cells and with growth factors, and make it so that it was in a new home and in sort of a new potting soil. So we really condensed the fat cells.
So Tracy, how do you feel? How do you feel after getting the procedure?
I'm thrilled. I'm thrilled. There's such a huge difference.
So specifically, where did you get the injections?
In my cheeks, my brows, and my chin and my mouth.
Was it painful?
No, actually, this was not painful at all. Nothing. The only discomfort was the swelling immediately afterwards, but that went down within a week. There was a bit more swelling, which was not that noticeable, but all the discomfort with my face, 3 days tops.
3 days. So what makes this different, doctor, than, say, Botox or these other injections that we've heard of?
Well, Botox is something that paralyzes the muscle, and then there are fillers, such as Restylane, and there are fillers that they use, but this is from your own body. So as you said, I call it the green technology, green cosmetic surgery, because you're reusing and recycling, and the best thing you can transfer is from your own body. You don't want it from cows, or you don't want it from bacteria, so your own body cells are going to be extremely well accepted and last a long time.
Is this a one-time thing? You get the procedure done once and then you're good to go?
Well, sometimes there is a residual swelling that disappears, and people like that original look, and we can do touch-ups later. We can actually take the fat and bank it for a year to a year and 3 months, and we can use future injections from that banked fat, or we can just simply harvest some more.
So is there anybody that would not be a good candidate for this?
Well, the sedation is sort of a conscious sedation, which is the same thing as people had a colonoscopy. I mean, we just did a lady from Australia who's in her late 70s, and she got clearance from her doctor. And because we just sedate them, we don't really give them a general anesthetic. It's as long as we get medical clearance.
Okay. Now, Tracy, with your new look, are you feeling different? Have you changed your lifestyle at all?
I haven't changed my lifestyle. I feel great. I just have my confidence back.
Good.
You know.
Wonderful.
Yeah. So I feel wonderful.
Great. Okay. So you call it the green procedure.
Green cosmetic surgery.
Green cosmetic surgery. Okay. Interesting. Okay. Well, doctor, thank you so much for joining us today. Tracy, thank you. You look beautiful.
Thank you.
We'll see you around.
Thank you for having us.
Thank you, guys. Okay.